Hello, everybody. So, before I kick off today's episode, I do want to let you know that Dr. Kuba and I were convinced to record ourselves in this podcast. And so, check the show notes if you want to watch this instead of just listen to it, then you'll be able to access that video of our lovely faces. Also, I want to mention to you guys that we've got a lot of stuff that is being rolled out. A free webinar, a leadership conference coming up, just so many announcements that you are missing out on if you're not even just a free subscriber. So we've got several different subscriber options. One of those is just a free subscriber option, which gets you a lot of benefits, including firsthand information, and then also the ability to access a free webinar that we're going to be dropping this week, actually. So pause, go and become a free subscriber today. If you're really smart, you become a paying subscriber, but at least become a free subscriber. And then the last thing I'll mention is this is a very sensitive subject that we're discussing today. It's very fresh. This just occurred last week. I know it's been all over the news. I want to make sure that you guys hear the tone of respect and appreciation that Dr. Kuba and I have for the office that went through this scenario. And we hope that there's much that we can learn and think about from this scenario, but we also hope that you hear the utmost respect that we have for all the people involved in it. All right, without further ado, here's today's episode.
All right. Hey, lady.
Hey.
We need some barf buckets here for sure.
There's a big one over there. Should we pull it into?
We're gonna need that. Yes. Because today I want to talk about something that's trending in the news right now.
Mm-hmm.
Okay. So I feel like everybody and their dog has sent me this. So I would imagine that every listener right now has heard about this.
Seen it, heard it, something, I'm sure.
So I think you know what I'm talking about now that I've said that.
Okay. Oh, yeah.
So I'm going to just read you the article that was sent to me.
Okay.
North Texas dentist arrested for allegedly performing surgery while intoxicated.
Yeah. Wow. Okay. There's a reason that it's trending on news, huh?
Yes.
Yeah.
So I think there's a lot. I have a lot of questions on this from a perspective of, what do you call it? Innocent until proven guilty.
Mm-hmm.
And, now her attorney has said, we're waiting on the results of the blood work. She's not intoxicated. She was fine. And then to me, like things like even the inflammatory while performing surgery, so I think there's so many things to talk about here. And I want to approach it from the angle of I'm a practice owner.
Yes.
And I can imagine this practice owner, oh my God,
yeah.
WTF, what am I going to do?
Yeah.
And so I want to take it from that angle if we can.
Agreed.
Because I want to make this a productive conversation. I don't want this to be a gossip mongering, try to, whatever.
Yeah.
But just as a practice owner, first of all, my first thought is when you read the stories, it's talking about how it's a temp doc and owner doc. So this is a small private practice. It's not a chain or anything like that.
Yeah.
So small private practice owner and was apparently out of town, out of the country.
Yeah.
And my first thought when I heard that was, oh my God, I can never leave the office. Like we already feel that way. Owners already feel that way. Like, we're listening to calls or we listen to a conversation with the parent or we see something that our team posts on social media. And it's always like, do I have to do everything? Can I trust anybody with anything? That's a lot of the burnout of being an owner is
you can't get away.
Well, and we're type A. Yeah. And so for us, like I was just even meeting with Dr. Mar the other day. She's been a guest on our podcast before and we had breakfast the other day and she was like, yeah, like we are also such type A, like we can find fault in everything.
Yeah.
And it's like, when is enough? Like, when is this good enough? When is it like, do we need to back off? Because we're going to burn ourselves out over a phone call that wasn't answered right or a post-op instructions that we didn't like the way our team said it, right? So at some point, so my question is, this was another one where I'm just like, can I just never leave the walls of my office?
Yeah.
And so when you dive into kind of what's been available, it's apparently this doc was sent by a temp agency and had met all the, background checks and all of that. And that the office manager also checks and vets. And apparently this doctor had been in the practice one or two times and nothing weird was noted.
Yeah.
So it's like, you can't fault the temp agency. They did their part. You can't fault the office. They did their part. And frankly, for this doctor, I don't know her, but my heart goes out to her. Like, somebody I know made the comment like, who's drunk at 9 a.m.? And so we're all judging her without having full knowledge of
her situation.
So I just I guess, can we tackle that first? Can I never leave my office? Because I'm sure that's how we're all feeling. Can I just never leave because I don't know what's going to transpire when I'm not there?
Right. And that was the feeling that I got when I read this article, is that I'm the one always encouraging my clients, because mental health is such an important thing with dentists in particular, that I'm telling them, take a break. It's okay. Shut the practice down if you have to, but leave. And I know the bills are always there and we've got to, feed our team and feed our family. So I get the pressure of that, but I'm a number one advocate for take time off. Even if that's a day or two here and there, please go do that. And my concern when this article came across, especially with it being a temp dentist that was covering, for one of the absent doctors, I thought, oh gosh, here we go. Every dentist reading this article is going to think, I can't ever leave. And that we can't let that be the default. We can't come and read an article like this and go, okay, so that proves that I can never leave. If it means that you now feel uncomfortable with ever bringing a temp in, okay, that's fine, but you still need to take time away from the practice. And I know that may open up a whole new can of worms where it's like, okay, well, now that I've been scared enough into never hiring a temp, then what do I do with my team when I take this 1 week off in the spring and in the fall? Okay, that's a whole different scenario that you're going to have to solve on your own if you're choosing not to bring a temp into the office. But I think we've got to realize that this is a very rare occurrence. The reason that this news article is going everywhere and you keep getting contacted about it is because it's rare. This does not happen.
So I'm going to argue that in a minute, but I think it's getting all this attention because it's a kid involved.
Yeah.
So that's number one. And I think the same thing too, like it just chaps my hide that they're like performing surgery. I'm like, you know what? Like, yes, that is what we do. We are every day, we remove disease from a body's tissue.
Yeah.
And otherwise, we're just the dentist, and I don't want to pay for that filling and insurance with all of their nonsense. And the, OR is not going to be covered for our patients. And it's like, okay, every other medical specialty has access to what they need because they are treating disease. For some reason, dental has always fallen outside of that. But that is, make no mistake, that is exactly what we're doing when we are scaling and root planing. We are removing disease from tissues to get them healthier. And yet somehow now you give us credit for it being surgery.
Yeah. When it's in a negative light, we're willing to call
it make it inflammatory.
Yeah.
So I think between the verbiage and the fact that it was a child,
yeah.
But it's not. We even had the podcast a couple of months ago that you had about, was it a hygienist or an assistant or somebody who kept going to the bathroom?
Yeah.
And y'all discovered she was smoking weed in the bathroom.
Yeah.
So through some of my consulting work that I do, I know this is not an unusual occurrence for doctors and dentists and team members to have to be professional recovery network and substance abuse and things like that. I don't think this is a unique or a one-off by any stretch in dental or medical.
Yeah.
Anywhere,
quite honestly.
Yeah, anywhere, quite honestly. It's just people get away with it.
Yeah.
And that's what's scary. And that's why we always have to keep our guard up, to be watching each other and looking for signs of mental health. And if we sense our colleagues are going wayward or whatever. But this is not unique. I think the reason it is catching attention is there's a child involved and the verbiage we're using is highly inflammatory.
Yeah.
Surgery while intoxicated.
Yeah.
That's my opinion anyway.
Yeah.
So
I think you're probably right. And I agree with you. I don't know that when I say this is rare, if you look at the amount of dentists showing up to work on a daily basis across the world, if we look, there may be a tiny fraction that have a substance abuse issue that is caught impairing them in the moment. Are they showing up to work sober, and as soon as work's done, they're getting drunk
or they're hiding the signs well of their gummies or their whatever it is they're doing. I think the other thing is the photo that was released of the doctor
makes it look bad.
Like it's not a flattering photo, and it does look like something's not right. But again, it's your mugshot. Like, how are we allowed to be like?
Do you smile at the mugshot? I mean,
like she looks like she's upset and or whatever. Like, but what would my mind be going through if I just got arrested and now I'm so? But that photo is one that does not
also makes it worse.
That does not. That makes it look like something. Anyway. That's my opinion on that. But I forgot what we were talking about.
We were talking about, can you take a break? And I'm nervous that this article is going to make a lot of dentists think that they can't take a break. And I really don't want that to be the outcome, because we have to have it. To your point, you are doing dental surgeries on a daily basis. You are having to manage team members. You are having to manage patient expectations. You're having to deal with insurance. This is a highly stressful field, medical or dental, but I think especially in dental, because we don't, until something bad happens, we don't get the proper respect that the field deserves. And so you add that to the equation, and you're having to convince patients on what they need to do for their health. And so it's highly stressful, and you've got to not sink to the idea that you can't get away.
And I don't think, at least as far as what I've read, I don't think there's anything this office could have done different.
Yeah.
And I think when the original story came out, it was, why didn't anybody catch this dentist? Why did they let her practice for half a day, whatever? But then you read subsequent stories and you find that that's not what happened.
Yeah.
So it's hard to know what to believe and not to believe. And at the end of the day, I just put myself in those shoes going, okay, I'm going to be out. My options are either not to go and to be, a prisoner in my own jail cell here that I've created for myself, which is not healthy and will lead me to retiring, shutting down, selling a lot sooner.
Yeah.
Or I shut down those days and take a big hit.
Yeah.
And and potentially lose team members, or I get coverage from a reliable staffing agency that has a good record that does. So from my side, I'm like, what would I do different if I was this practice?
I know.
And I don't have an answer to that. It's like, I don't think I don't think they could have done anything different.
I know. Which is sad when you think about it, because first of all, we've got kind of two things going here. You've got, of course, the doctor in question here, the one that was arrested, and you're like thinking about it from her perspective as a dentist. You're like, okay, that's a big deal that we're talking about for her. If this turns out to be true, that she was, under the influence of something, my heart goes out to her. But also, some of the comments that I've read as I've been following this story is that, which is infuriating to think about, but that other people had commented that she temped in their office. And one comment in particular said, oh yeah, we ended up sending her home, partway in. And I'm thinking, well, that's really unfair, because then how long have people been concerned about her? And again, this is a doctor saying this about her practice. And so I'm thinking, okay, well, other people might have noticed signs before, but they didn't make a call or make a report.
Or try to help her or talk to her.
Yeah. And again, I know every decision that we make is challenging in a dental office. But then if you do have the situation where a temp doc shows up and they're not seeming to be capable for whatever reason of performing the role that you have for them that day, But I'm thinking, okay, now you've got, apparently in the light of the story coming out, people are saying, okay, yes, we've witnessed this behavior before. But then you've got an office here that actually made a very difficult call to do something about it. And my heart goes out for them, because I know the publicity on this is not helpful to their business at all.
There was a patient that commented on Facebook and was like, oh, my autistic grandson goes there.
Yeah.
And they've always taken great care of him, but I don't know if I can go back there again. And I'm just like, that my heart breaks for everybody involved.
Yeah.
Honestly.
Yeah, but absolutely. It's a bad situation across the board. But then knowing as a practice owner to be hit with something like this, when, like you said, to go back and think about it, what could they have done differently? Shut the practice down. And, the doctor has to take a break. Because if we go off of that premise, doctors, you have to have a break. You have to. Then it's like, okay, the options are never hire a temp and shut it down. And that's fine if that's what people decide to do, but then that's highly financially impactful to not only the practice, but the team members. And so it does lead to this ripple effect of, I don't know what else could have been done differently in this case. It's just, how do you deal with the aftermath now? And hopefully this never hits any other practice. But I think it begs the question, like, looking at this story, it's really hard to poke holes in what the practice did. It seems like, based, especially, I know a People article also came out recently on it, and it made it clear it was one patient that the assistant stepped up and called it off and like, let's pause this because she noticed. And so it's like she didn't even make it far into the day, and the practice is so watchful of their patients that they're taking action. And so it's like, it's really hard to pick apart anything other than, okay, what do we do? Just not use temps.
Well, and then the other part of it too is like, again, with the stories, the initial story I read about it that came out was, they didn't state that.
Yeah.
So now the public perception. So if that was, say, I think I read that on Tuesday, and now coming to, what day is it today? Friday.
Yeah.
And the People magazine picked up this story. Like, my sister sent it to me from People magazine. And on that one, it clarifies.
Yeah.
But so now patients have had this whole week. People in that community have had a whole week to make their judgments on this practice without all the facts.
Yeah.
So, okay. So that was the one thing I want to talk about. Like, as a private practice owner, my fears are like, okay, I guess I can't ever be gone. And the answer to that is no. We need to think about it. The next question I have is, what would you do? Like, so obviously you're a consultant, and so here, what would you advise that team to have done? Or what, I guess I don't know. Like, if this is happening in my part, or what would I have done in that situation? Should I have done something different? Like, what if it had gone half the day and the team didn't catch the signs?
Yeah.
Like, what are we looking for? I guess I just don't even know. Like, thinking about it in my own mind, going, okay, say I am there, or say I'm not there, and an associate comes in. Like, it's not even a temp. What if it's my associate that comes in?
Yeah.
Or flip that. What if it's associate and now I come in and the associate's like, Kuba's acting weird.
Yeah.
She did have a party last night, or she was stressed about something, or her whatever it is, she's not acting right. Like, what should we be doing, or what should we be watching for?
Yeah. I think that's the exact right question here, because to me, we can't, just because we've worked alongside somebody for a long period of time doesn't mean that we can't call them out and actually address the situation that we think is off. And maybe it's not under the influence of something. Maybe it's just like, they seem off today. And this has happened quite a bit. This happened in a conversation that I was having with a team member yesterday, that something felt wrong in the way that she was reacting to me. She wasn't making eye contact with me. She was only giving me one word answers. She was not being her normal self. And before I continued in the training that I was doing with her, I just stopped and I was like, hey, are you okay? You seem off to me today. Everything okay? And so something had to be on her mind, because she looked at me and she was like, "Oh, I'm fine. I'm fine." And then she returned back to her normal self. And I was like, "Okay, nothing going on. No big deal." But it was enough. I was paying attention to her enough that I was like, something's wrong, and I need to pause and check on her. And so I would say, whatever it is, whether you're assuming that they've got a big hangover, whether you're assuming they're mad about something, it doesn't matter. If it makes me think of the airport. If you see something, say something. It's like, if you see something that's bothering you, don't just chalk it up to no big deal. Actually say something, which thankfully it sounds like this office did, that they caught it. The assistant in the op room is like, something seems off. I'm going to stop this and figure this out. And so I think, whether it's a temp doc, whether it's a temp assistant or hygienist, or whether it's somebody that you work alongside, we need to be checking on each other. And if something seems off, if my hygienist is in between patients and she's laying her head on the desk taking a nap, and that's not her norm, hopefully it's not her norm.
It's not.
Then we should be checking in on her. Like, "Hey, you seem really tired today. What's going on?" And as she's talking, we're watching physical signs. When I woke her up from that nap to see if she's okay, do her eyes lock in on me? Is she seeming like she's actually alert? She just was really tired because her baby kept her up all night. Okay. Watch and evaluate how your team member responds to you checking in on them.
I also think this points back out to, you got to know your team members.
Yeah.
And so a lot of times we as doctors tend to be a little hands off. I know I'm stereotyping here, maybe getting myself into some trouble, but I feel like men are probably a little bit more like, I don't know. And females, we're scared, at least for me, let me speak for myself. A lot of times I'm like, I need to make sure I'm not crossing a boundary.
Yeah.
Because if I seem like I'm checking in too much, now I'm their friend. And anyway, so what system do you have in place to go though? Do I know my team member or do I not? Or do I have an environment that one assistant could come to me and say, "Hey, Susie's not acting right," or "Something's wrong"? Or is my team just oblivious about each other? Are they always picking on each other? So now I can't make heads or tails of if something is up. Then it's like, well, you guys squawk about everything. So I don't even know
what's truly a concern.
What's truly a concern or not. So I think that it just brings back into communication, paying attention to your team.
And being willing to say something.
Yeah. And I think also, like, just as owner doc, we do tend to have our own, we're stressed about the veneer case. We're stressed about this mom coming in who wasn't happy with how the sedation went. We're concerned about, meeting payroll this month because we had a snowstorm and we didn't produce, right? Like, so we've got a lot of things on our mind, and it may be easier to just go, okay, everybody's here, and carry on. It does take a minute to pause and to, like, be able to, one, notice when something is off, or two, do we have an environment and a culture where somebody could come to me?
Yeah.
And I could take that seriously and be like, okay, this person is pointing this out for a reason.
Yeah.
But if you're always pointing out and complaining about people, or, Mary's crying today. Well, Mary cries every day. So like, what,
Yeah. Yes, exactly. And I would say, even to your point on that, one of the things that I thought about in relationship to this, it was a similar experience that one of my clients experienced with her assistant. And she had and again, she knows her team well, but she's not, you don't have to be buddy with your team to know them well. You just have to know what is their typical pattern. And she's this type of dentist where she knows her team, on good terms with her team, but buddy, or let me ask how your weekend was or anything like that, she just doesn't do it. But she was aware enough to know that as this procedure started, that there was something different with the way that her assistant was passing instruments to her. She was like, "What's going on today?" And so at one point, when the assistant passed the instrument, it even flicked, like the instrument kind of flicked and dropped on the patient's chest. And it was enough of these subtle signs that afterwards she had the conversation like, "Are you okay? You seem really jumpy today. And you weren't your normal self in that procedure." And as the assistant was talking to her, the doctor did not feel confident that she was okay. But the assistant was like, I'm totally fine, blah, blah, blah. So what my client did, which is hard to do, thankfully she's got 2 assistants, but once she finished that procedure, she subbed out the assistant. She's like, this assistant B, you're going to be my assistant the rest of the day. Assistant A, I need you to do these organizational tasks, or if you're not feeling up to it, you can go home. Right. So it was the employee's choice. So the employee stayed, got the organizational tasks done. And then that employee came and talked to my client at the end of the day and said, hey, I wanted to address what you saw earlier. And for her, it was a legitimate reason. She had some medication changes. She had been on some antidepressants. She had been on she had some attention, like cognitive type things that her doctor was changing some medications around. And she had realized it made her like extra jumpy that day. And so she didn't offer that up in the moment, but by the end of the day, she was like, hey, I just wanted to let you know what was going on. So it doesn't even have to be like intoxication. It can be, there are medication changes that are happening that changes your clinical team member enough that you're like, I'm going to notice it. I'm going to address it. And then I'm going
to addressing it. I would be fearful of if this person's going to be like, how dare you sub me out?
Yeah.
I told you I'm fine. You're just picking on me. I'm leaving. Like, I guess to me, I just think of that worst case scenario. And then I'm like, ooh, what do I do? What do I do here?
Yeah. Yeah. Well, again, none of it's easy. None of this is easy. But I think we'd be remiss if we didn't say something, which is, again, I think back to what's even prompting this conversation. And for that assistant to stop a procedure with a doctor, that takes, excuse me, but that takes some balls to be like, oh gosh, something's off enough that I need to stop this procedure and figure it out. But the patient care comes first. And so we have to make those difficult calls. And maybe it's not something super obvious, but it's just enough that we're like, I don't know, this doesn't feel right. Trust that gut, follow it, and do the right thing. Because at the end of the day, patient care comes first. Our relationship with that person doesn't come first.
Yeah. Okay, so my next question to you is, so like this happened, this story hits the news. Let's say it doesn't hit the news because it doesn't happen that often, right? But let's say a patient's mad, like something that would be more equivalent that would happen is a patient is really mad and then they're blasting us on Facebook and all of that. Mm-hmm. What do we do? Mm-hmm. Or I guess you could answer it like, what would you have advised this office to do that if this happened on, I think it was a Monday, and then by Tuesday it's hitting the news, what would you advise this client to do from, I guess, a PR perspective and or an actual, like, what would you advise this dentist to do?
Well, to me, and this is our theme, so we're getting a little bit ahead of our theme for the month of March, for our subscriber content that's coming out in March. But the whole theme is, what can we learn from the storms that hit us? And to me, again, thinking about this situation, we've got several things we need to address. You had to know it was coming. This is such a good topic, and we have so much more to say about it that we're going to cut you off here. If you want to hear the rest of this, you have got to go become a subscriber. So check out the show notes to figure out how to do that. Now, I do want to let you know one quick announcement before I completely cut things off today, and that is that we have dropped the information for our webinar. It is going live very soon. It is a free webinar broken into 2 different 1-hour segments. It's meant for the whole team, and it is content that you do not want to miss. You're going to be able to access this webinar for free by going to become a subscriber, a free subscriber on Patreon. And once you log in to be a free subscriber, then you'll be able to access that webinar. So don't miss it. It's excellent content, and have a great rest of the week.